The main resource that I think the hotline offers is first a gateway to mental health help if that person is wanting that, and also education. A lot of times folks are naive to mental health help or don't know how to access it. So one of the big things that we offer is an avenue to try to help people learn that. We also help set folks up with help if they're looking for it. We can do that in a multitude of different ways, but one thing that we often ask folks is where would they prefer to get that help? Some folks aren't comfortable getting help at their local primary care provider's office or in their hometown. So are they more comfortable getting help through Avera's telehealth system or in a different locale? I will say we see some common themes, probably the first one being financial concerns, whether that be fluctuating commodity prices, insurance and input costs, livestock illness, unexpected repair costs, those types of concerns are probably one. A second one would be unpredictable and oftentimes devastating weather events. Just the last few years we've seen drought, floods, derechos. We didn't even know what that word was a few years ago. A lot of folks are comfortable going to their local pharmacy for their diabetes or their cholesterol or their antihypertensive medications, but picking up a psychiatric medication induces a significant amount of fear and stress for them. We have partnered with our pharmacy here at the Avera Behavioral Health Center. We'll send stuff through the mail for them just to avoid that and help ensure that they're taking that medication and help with compliance and hopefully get them feeling better. One of the biggest things that we've tried to champion since we started the hotline is to encourage those folks that you see needing help to get help. Pride and the mental health stigma still prevent a lot of folks that need help from getting help. A lot of cliches over the years have been used, especially with mental health, whether it's pull up your bootstraps, throw it under the rug, rub some dirt on it. Those types of statements need to stop, and we need to get folks in for the help that they need and they can benefit from. I tell folks it's the producer themselves or anyone that has a concern about a loved one or has questions. They can call in to help either get that person facilitated into getting an appointment, or they can just ask questions and get some education that they can then pass on to that person in hopes that that turns into a phone call later. Our hotline is staffed 24 hours a day, 7 days a week by licensed mental health counselors who are trained in assessing that person's immediate needs, if they're any acute danger, if they're actively suicidal, but then also facilitating setting up whether it's psychiatric appointments or counseling appointments, whatever that person would prefer.